Today I will explain about the measurement of blood pressure. Before measuring the blood pressure, initially we have to know what is mean by blood pressure. The blood pressure is the pressure exerted by the blood against the walls of arteries. Its normal value is 120 by 80 millimeter of mercury. 120 is the systolic blood pressure and 80 is diastolic blood pressure. Systolic means when the heart chambers are get contracted, then the pressure exerted by the blood against the walls of arteries is called systolic blood pressure. That is 120. 80 means when after the contraction of the ventricles, then they have to get relaxed. During the time, the pressure exerted by the blood is called, that is diastolic blood pressure. I hope you are understanding. For the measurement of this blood pressure, you need an instrument. Its common term is BP apparatus manual and its medical term is sphygmomanometer. What is that? Sphygmomanometer. Now you can see the parts of this apparatus. This one is mercury scale, and this one is rubber tube, and this one is bulb. This one air releasing valve. This is rubber tube, and this one, what is this? Cuff. This is inflated cuff here. This is about the parts of this instrument. For the measurement of the blood pressure, you have to follow three methods. One is auscultatory method, second one is palpatory method, and third one is oscillatory method. Auscultatory method means for the following of that method you need a stethoscope. This is stethoscope. With the help of stethoscope you can hear or listen the pulse beat. For following of this method you need a stethoscope. Next one, palpatory method. Palpatory method means here you don't need this stethoscope. Only means without stethoscope how can you measure? By the sensation of your fingers. With the sensation of your fingers you should analyze the pulse beat. If you measure here, you can put your fingers like this. If you measure here, you can put your thumb here. That is palpatory method. Here you don't need this stethoscope. Third one is oscillatory method. Oscillatory method means when the pulse beat starts, at the same time the mercury will oscillate. At the same time mercury will oscillate and continues. That you have to measure as a systolic blood pressure. If the oscillating starts at, for example, 120, you should record that is systolic blood pressure is 120. And yet that continues and stops, for example 80. If it stops at the point of 80, you should consider that as a diastolic blood pressure. And also one thing, for the following of this oscillatory method, you need lot of experience. Because sometimes due to the other reasons, the mercury may oscillate. Keep in your mind. Now you can see the measurement of this blood pressure practically. You can see this cuff should wrap around the arm. This should not too loose and should not too tight. That we have to wrap here and put the stethoscope here. Stethoscope here. And slowly close this valve first, and you have to pump the air like this. You can see mercury will goes up while pumping the air, and slowly we have to release the valve here like this. Like this you can observe. While the mercury is coming down at certain point, here the pulse beat hears in the stethoscope. With the help of stethoscope you can understand the pulse beat. At what point the pulse beat starts, you can consider as a systolic blood pressure, and it continues and stops at certain point that you have to consider as a diastolic blood pressure. This is auscultatory method of blood pressure, means here you need a stethoscope. Next, for the palpatory method you don't need stethoscope. Remove the stethoscope. Only you push the air like this, the mercury will goes up, and you have to put your finger, thumb finger here, and you have to analyze the pulse beat with your by the sensation of your finger. You can see the mercury. While the mercury is coming down, at certain point the pulse beat occurs here, that we have to analyze with you by the sensation of your finger only, and at certain point it will stop, that you have to consider as a diastolic blood pressure. Next one, oscillatory method. Oscillatory method means here you don't know stethoscope as well as your finger sensation, only we have to observe the mercury. While the mercury is coming down, at certain point it will oscillate or jumps. That point you have to consider as a systolic, and it continues and stop at certain point, you have to consider as a diastolic. For example, if the oscillating stops at 80, that is diastolic. And also one thing, for the following of this method you have lot of experience, because already I have told, due to some reasons the mercury may oscillate. Keep in your mind. I hope you are understanding. Please like, share and subscribe my channel. Thank you.